I now invite Dr. Murali Krishna sir to give his presentation.
Good morning, everybody. This is a rare privilege for me to stand before you. There are experts even from different parts of India, and there are also postgraduate students, students of this college, and participants. Though they have experience, again there is an inquisitiveness, enthusiasm to learn, because the physician, once you adopt the profession of physician, you need to learn the things as till your last breath. So this must be the nature of the clinical profession, especially whether it is a modern system or Ayurveda. So I confine myself to the Ayurvedic management of allergic respiratory disorders. My foundation in undergraduation from Nagarjuna University and post-graduation from Banaras Hindu University. Naturally, we have a little focus on understanding the disease Ayurveda and modern medicine. But we have staunch supporter. I have the nature of practicing Ayurveda, and I believe that Ayurveda is a far excellent medicine than any other system existing in the world. So with this due considerations, whatever that I say, we need to understand that, and whatever the experiences I come across, I quoted certain classical things. I also put the blend of my experiences of 27 years practicing in Ayurveda, practicing dealing with the different diseases. So this is a rare privilege to share my views and clinical experiences with you. So with this little introduction, I thank the organizers for giving me this opportunity. So of course, you know, I hail from the Lord Balaji's Tirumala Tirupati Devasthanam. There where we have admiration and respect, and my due respect, because I am bound by the Lord Balaji's blessings. I am working there in Ayurvedic college, and this is, if you see, Lord Balaji is every day Snapanas Tirumanjanam is done, is given bath. So every time before going to bath, Dhumana is there, Dhupam is led, and Tulasi Mala is also offered. Tulasi Mala has a very unique privilege of dealing with Pratishaya, Kasa and Tamakashwasa. So that is the reason why here the traditions are being still followed. Dhuman Nasya is one of the important modality of treatment, even all these respiratory disorders. With this, I focused this Lord Balaji with Sridevi and Bhudevi. So this is my working area of the hospital, 210 bed hospital. The services are offered free of cost. No even user charges are levied. Absolute free treatment is given to the patients who hail from even different parts of India, and this is our college where I am working. So coming to the allergy, so usually you understand allergy either in Ayurvedic perspective or in modern perspective. Nothing much difference is there. If you go into the details of modern medicine, you will understand the better way that actually the things are dealt very similarly. So that is the reason why for Pratishaya and Kasa and specific Tamakaswasa, you have the similar line of treatments appear in the classics. So we come across more or less similar formulae are even given for these advocations. So if you see the allergy has become now, there is an influx of NRIs taking treatment from Ayurveda. So I used to get non-resident Indians, children, if they come to my clinic or if they come to my hospital, the first question I used to ask them, what type of allergy you have? Because they come for only allergies. All the Americans, especially American NRIs, they come for allergic disorders. Either it is a cutaneous allergy or respiratory allergy. So that is the reason why if you see 25 to 30% world population suffered by allergy. Allergy ranks 6th leading cause of chronic diseases, and 50 million Americans suffer from allergy annually. 18 billion spent on these patients, and several such publications are there because of their mandatory vaccination procedures. because the child must go for vaccination full course, then only those children can be admitted in the schools. So the type of mandatory vaccination procedures, the immune system is activated for hypersensitivity reactions through allergens. So probably this is the theory. So that is the reason why they are more effective, because they are suffering from the allergic than any other states in the world. If you go to the etymological derivation of allergy, it was coined only in 1906. It has only 108 years of longevity. So allergic concept was developed in modern system only 106 years, but allergic concept was already identified in Ayurveda from begin back to Charaka Samhita. So allergy is not an abnormal condition, but you see this is an altered state, and it is an altered reactivity. That means it is a physiological response, but in excess. It is physiological response. It has to be responded to the environmental factors, but at the same time, so very important thing is it is in excess, more than required. So if it is more than required, then we call it as allergic response as per modern system. So allergies, they always mediate through immune system. They are as such antigens of the allergy. They do not do any harm to the individual, but in the course of time, so because of the hypersensitivity of the individual, they are going to cause various diseases either in cutaneous level or respiratory level. If you see from the modern system of medicine, histamine is the mediator for all allergic reactions along with immunoglobulin E. So these are the two important things to be dealt or managed by modern system for the management of the allergic either cutaneous or respiratory disorders. But very important thing here is, because of allergen, fluid and white blood cells leave capillaries, and where you can get the inflammatory reaction in that area, and respiratory disorders are manifested. You see here, this is the frontline defender. This is called macrophage, and these are the allergens. This pictorial diagrams show that whatever that is the frontline defenders, slide. So these frontline defenders, macrophages, receive the allergen from the environment or either from the food. Then immediately this is submitted to the helper T lymphocyte, which is the commander-in-chief for total immunological process. And this helper T lymphocyte activates the B cell, which is very important for the production of immunoglobulins. And B cell is turned into activated plasma cell. This plasma cell is going to release the immunoglobulin E. So this immunoglobulin E is the response of immune system to allergens. Once this immunoglobulin E comes out, it immediately activates the mast cells. Mast cells are there in the circulation, and immediately these mast cells or basophils release the histamine, and this degranulation of the histamine is taking place here, and this histamine is going to cause several abnormal conditions like capillary dilatation, enlargement of capillary permeability, and airway constriction, mucus secretions, all these things. But very important thing here is, this phenomena is physiological, but once the subsequent attacks of allergens directly activate the mast cell and immediately destabilize the mast cell, and degranulation is taking place in the form of histamine. So that means this second or latter exposure is a very, very essential thing in the allergic reaction. So first initial allergic exposure is a physiological phenomena. Subsequent allergic nature is a phenomena where hypersensitivity or hyperactivity or excess activity more than required is taking place. So why we need to understand? We need to understand this because the etiological factors where it is dealt in modern system of medicine. Let me focus to few aspects, that is atopic nature, the individual innate nature which is sensitive to allergens. So this is very important. That means innate factors are very essential. As Ayurveda also say, Prakriti is very essential. Innate factors are very essential. Innate factors in the form of Tridosha and Saptadhatus and Trimalas, along with the Prakriti of the individual. That atopic nature is very important, and after the atopic nature, Then the external factors like pet dander, dust mites, cockroaches, fungi, foods. Even Ayurveda also say Rajo Duma. These are some of the important allergens described in Kasa and also in Swasa Rogas. So free radical theory is also another theory where free radicals exposed by the individual going to initiate the immunological reaction, and superoxide dismutase like antioxidants, if they are intact in the body, that can be tackled. So if that is not intact, then it is going to cause harm. So these are the etiological factors identified, either innate mechanism, that is the atopic nature of the individual, or external factors, and free radical theory, either from the emotional factors of the individual or exposing to certain chemicals by the individual. All these are going to work out. So the allergic response, as I told you, if you sum up with this, it is mediated by immunoglobulin E, that is known, and first is sensitization. Sensitization I have shown in the picture, that once the allergen comes to the mast cell and B lymphocytes are activated and plasma cells are going to release the immunoglobulin E. That is called sensitization. The second is early phase. Early phase is going to leak out the histamine from the mast cells, and then all the allergic reactions are initiated. And the late phase, the same allergen subsequently come to the mast cell and immediately need not be initiated by all the previous activity. Directly the mast cell degranulation is taking place. That is the reason why modern system focus more on mast cell stabilization, or either blocking of the histamine from the production of mast cell, that is the produce of the mast cell. So these are the three important things which we come across. Sensitization is first, early phase physiological response, later phase it is the excessive response more than the required. So if you see nowadays, every NRI used to say that they have a food allergies. So food allergies, n number of food allergies are being identified by them, because the society is so fluent. But even in India also we are going to come across such type of food allergies. So food allergies may manifest asthma, rhinitis, urticaria, eczema, gastrointestinal symptoms, abdominal pain. These are all identified by skin prick test, but about 20 to 30 skin prick tests are there. But after considering them, even if you forego those use, still the patients are getting the allergic reactions. That means even skin prick tests are also not working effectively for understanding the cause and effect phenomena of the allergic reactions. So certain additives like artificial colors, food preservatives, nowadays we are going to get even the chicken and non-vegetarian food like fish, where the growth enhancers are given for them to grow. These are all powerful chemicals going to directly influence the allergic reactions in the body. So we are exposed or countered by several provocative factors from the environment, either in the form of food or even in the form of other pollutants or allergens from the environment. So these are all the things, but whatever that may be the things, we have to set the things normalcy in our own body. So that is the reason why our concept of allergy in Ayurveda is discussed in these areas. There are scattered descriptions available in the context of Dushi Visha concept. Is an excellent concept which is fit to the allergic reactions, that is called Dushi Visha concept. Amavisha, which is a food reactivity which is mediated through Amavisha concept, and Viruddhahara is incompatible diet. Incompatible diet is the really very important area which is not touched by the modern system of medicine so far, or modern nutritionists so far not touched this area. This is also a potential area. Now the nutritionists are going to work for this, and Viruddhahara concept is also very important. And the allergic activity is described as a pathogenesis in Pratishaya, Kasa, Swasa, Udarda and Kusta. So these are the diseases where we come across the allergic reactivity. So what actually the Dushi Visha concept? Dushitam desha kala anna divaswapnair abhishnasaha yasmat dushayate doshan dhatun tasmat dushi visham smrutam. So that means here geographical influence, that is desha, effect of the desha on the body, all the environmental factors come here, kala, seasonal factors come here, diva swapnai, the sleep irregularities, we come across the allergic reactions aggravated, intensified by the narrow sleeping habits, or disturbed sleeping habits, or diversified sleeping habits where they go for day sleep and wake up throughout the night. So these are the things even still 100% perceived in the day-to-day practice, that they are the causes of the allergic reactions. And yasmat dushayate dhatun, ultimately they are going to influence the tridoshas and sapta dhatus, and tasmat dushi visham smrutam, directly it is going to influence the body. So but here abhishna saha means exposed repetitively for several times. This is very important. So by one exposure it is not going to cause the harm in dushi visha concept. Abhishna saha means it is several times and repetitively the individual has to expose to them, then only the dushi visha is one area where we can focus the concept of allergy in Ayurveda. But if you see the allergic concept in Ayurveda, due importance is given to innate factors rather than external factors. But of course external factors are described in the context of kasa, in the context of pratishaya, in the context of tamkashvasa, but the prime line of treatment in Ayurveda is nidana parivarjanam. So there the nidana parivarjana is also indicated, but due importance is given to the innate factors like tridosha and saptadhatu concept. The external factors are innumerable but explained under erroneous diet and lifestyle. If soil is unfertile, a potent seed cannot sprout. So the bija kshetra siddhanta, we are more concerned about the kshetra rather than bija. So that is the reason why there is no much description about the disease causing microorganisms in Ayurveda, disease causing allergens in Ayurveda, but they are scatteredly described. But we do not give much importance to that, because if the innate nature, the kshetra is good and the provocative factors from outside are not going to serve their purpose of causing the disease. So Ayurveda is searching causes within rather than outside the body. We always, of course, causes are there in the form of midyahara viharas, but always we focus more on the innate factors of tridosha concept. So that is the reason why even if it is an allergy, allergy has to take the course in the form of aggravating the vata sleshmas. Then only it can initiate the activity in the form of allergy. So factors involved in allergy as it is described in Ayurvedic concepts is incompatible erroneous diet. If you sum up the causative factors for pratishaya, causative factors for the kasa, and causative factors for tamakashvasa, you can sum up here like this: incompatible and erroneous diet, suppression of physical urges. This is a very unique concept of Ayurveda. The suppression of natural urges are going to trigger the immunological perversion, either in the form of allergic disorders or immunological disorders, immunological pervertive disorders in the form of autoimmune disorders. So erroneous sleep habits, this is also very important. The sleep habits are narrowed, our medicines are not even going to fully work out in the conditions of the patient. So we used to advise the vihara for them, that a proper sleep is very essential to combat or even overcome the allergic respiratory disorders. So environmental factors, initially we need to prevent the exposure to them, and later even the individual is set to the normalcy. The slight provocation from the environment is not going to cause harm to them. So excessive physical activity or excessive coitus is also described. So smoking and pollution, all these are the factors, that is from Rajo and Dhuma. Pollution concept is taken from the Rajo and Dhuma, that is particulate matter from the environment and also smoke from the environment. These two are taken from. So why in the modern system there is a limitation? Of course, in acute management is life-saving, no doubt. If anaphylactic shock is taken place, modern management is life-saving. We have to accept that. And at the same time, it is also good. But several allergens are identified. Recurrence is very common, and adverse effects also prominent. If they prescribe specific medicine, it is drowsy. If they prescribe for higher medicine, it causes a lot of side effects. So long-term treatment is unsatisfactory by the people who receive the modern system of medicine. Even modern experts also knew the limitations of their treatment. So that is the reason why the people are going for the alternative methods, especially the treatment from Ayurvedic physicians. So if you understand the first thing, I confine myself to the the Pratishaya and Vata, Shleshmaja Kasa and Tamaka Shwasa. These are the things which are considered to be the allergic mediation in the respiratory diseases. I confine myself or my lecture only confined to these three areas. So coming to the allergic rhinitis, let me say few things, facts from the modern system. Allergic rhinitis is the commonest allergic condition faced by medical practitioner. May present either alone or in combination with asthma. Typical symptoms of sneezing, running nose, blocked nose, early morning sneezing. It's commonly seen in dust allergies. So I used to get number of IT professionals from Bangalore for receiving this treatment from only exclusive allergic rhinitis. Why? Because of their erroneous food habits, erroneous lifestyle, these are going to activate the allergic sensitivity in them, and they used to come to the treatment of Ayurveda. Once they get relief, and the other colleagues also come naturally. So that is the reason why we have a better option than the modern system of medicine. And patients having severe itching, the allergic salute, this is called allergic salute. Always they keep up the nose up, and there is a Darier's lines seen on the nose. By seeing them, even you can identify there is an allergic shining appears over the lower eyelids. These are all manifestations we come across. By seeing them, you can identify. So hay fever is another problem in especially in Western countries. They get a seasonal pollens, and these environmental factors are going to cause the all rhinitis features. These are also identified. Specific seasons, there is a working hours are being markedly reduced in corporate sectors in Western countries because of the allergic rhinitis. This may be surprising for us. So usually the manifestations are sneezing, nasal pruritus, rhinorrhea, or nasal congestion. If any of these 4 or 5 there, if more than one is there, you can just brand it as rhinitis as per the modern medicine. But we get all these symptomatology even in Ayurvedic classics. Absolutely, it is appears to be a better understanding in Ayurveda than the modern system of medicine. So now coming to the Dalhana's commentary on Susruta Uttarasthanam, Vatam prati abhimukam shayo gamanam kafadinam yatra sa pratishaya. Here the inhalation or is taking the air inside is the normal way of entry of the air inside. But opposite to that, if the kapha along with other secretions come, then these secretions are going to cause the pratishaya, that is called vatam prati abhimukam shayo gamanam kafadinam yatra sa pratishaya. So prati means opposite, shaya means secretions coming out. So opposite to the direction of the air inflow, that condition is called pratishaya. So simplified. And the causes, if you see, more or less they are modern possibilities. They said nari prasanga is one, excessive coitus, siraso abhitapo dhumo rajaha, by exposure to the dhuma and raja, siras abhitapa is taken place. Then sitam ati pratapa and sandharana mutra purishayoscha. The concept of vega sandharana is very important for the allergic disorders, whether it is cutaneous or respiratory. The sandharana is very important, and we need to advise the patients not to go for holding the natural urges. So these are the manifestations described in Ayurveda. The manifestations described in Ayurveda is almost more or less very equal to the allergic rhinitis described. Suklava bhasa, sunaksho, bhaved guru shiro mukha, shiro galoshta thalunam kanduyanam ativa, sitam sraved muhu muhu. So if you sum up all the classical references from Susruta, Charaka and Vagbata, these are exposing to the cold weather, open air or dust, excessive talking, reversion of sleep habits, use of very high or low pillows, drinking water other than native areas, excessive quantity of water intake, excessive indulgence in coitus, suppression of vomiting and sorrow, that is negative emotions, suppression of natural urges, indigestion, anger. So these are causes if you sum up from the all Ayurvedic classics. there are more or less even accepted by the etiological factors for allergies. So it seems to be that we have a better understanding than them. And symptoms of Pratishaya as described in Ayurvedic classics: dryness of mouth, continuous sneezing, impaired grana means the olfactory perception, pricking pain, pain in the teeth, temple area and head, crawling sensation around eyes, disturbance. These are all, of course, we know. So what I want to say here is, because we have a better understanding of allergic nature in Ayurvedic classics, and symptomatology are almost same. Etiological factors as they are identified in allergic origin in modern system is also very similar. Then we have a better option of understanding the disease in Ayurveda, and we can go for a better treatment options also. Now, Pratishaya Chikitsa, it is directed more towards the pacification of Vata Kapha. You always remember, wherever the allergic respiratory disorders are there, there is an involvement of Vata Kapha. So that is the reason why they are prominent either in dawn or dusk. During the Sandhi period of Vata Kapha, these diseases are very prominent. And the treatment modalities described in Pratishaya is Snehana, Svedana, the Sthaniya, and Pradhamana Nasya is a type of desensitization concept. I'll explain certain practical experiences of me in this regard. And Gandusha Dharana, and making it desensitization of the oral origin. And of course, these are the medicines primarily be prescribed by the Medi doctors all over India. Wherever I go, I used to get the information from them, and also I have my own experience. The Nardi Lakshmi Lasras is considered to be the best medicine for the Pratishaya, and Chitrakaharitaki Leshyam is really the great medicine which is derived from the Charaka Samhita, having an excellent possibility of overcoming the allergic sensitivity in individuals. So of course, this is my own experience. I was having the allergic nature some time back. With the Chitrakaharitaki and Jalaneti, I could overcome the allergic reaction almost completely. Very rarely I experience the allergic reaction, maybe once in a year or once in 2 years, not more than that. Earlier I used to get, because when I was a child, I used to say that every 12 months almost I was having the running nose. The people used to say about, even my parents used to remember me like that. But now almost free from that, because I identified that there is a prakriya from yoga, that is Sutra Jalaneti concept that I will explain in the end. Chitrakaharitaki Leshyam is another. Then I started prescribing these medicines to patients in a different modalities. So I used to come across. So Sarpi Gudam, Shadanga Yusham, Panchalavana Siddha, Vidaryadi Gana Siddha, Gratam for Nashya Karma. So of course these are derived from the classics, and experiences are also support these procedures. But let me explain my experience of practicing the desensitization in Pratishaya, because our concept of desensitization is very excellent. Avapedan Nashya is advised with the Pippali, Shigru, Bijani, Vidangam, Maricham. These are all pungents. If you make into Kalka and Avapedan Nashya is done with them, this is desensitization. I come across one patient used to go for nostril drops for every 1 hour. Even if he miss 1 hour, his nostril blockade is so vehement that he is unable to even stand. He crave for the air through mouth. So that type of nature. So when the patient came to us, even the modern system, modern nasal decongestants failed to help him. Then we started doing the Nashya in the form of Pratimarsha with the Shadbindu and Anulom, the Anutaila, and sometimes in some other cases I tried even the Avapedan Nashya also with the Kalka of the Shigru Bija and Vidanga or Maricha. Maricha is very pungent, but people used to face lot of problem initially, but in the course of time, it is nothing but desensitization of the nasal mucosa. This desensitization is going to desensitize even the allergic hypersensitivity, and they will be free even without any medicine after some time. So this, you believe in me, that these are the very important desensitization techniques. That is, if you go through the Pratishaya Chikitsa, I will show you so many references given by the different classics. They always say either Avapeda Nasya or Marsha Pratimarsha Nasya and Shiro Virechana in these conditions. Why? Because these are all procedures of desensitization widely used for the Ayurvedic classics and by Ayurvedic physician. Maricham Dadi Gudam. This concept, it is there in Ayurvedic classics, but I experienced when I was in post-graduation, my cook used to prepare this and used to give to me whenever I get nasal irritation. Immediately that is subsided. So once I refer the Ayurvedic classics, this is there even the Ayurvedic descriptions also. Dashamula Katutraya Kashayam is another very, very important medicine which we have excellent efficacy than modern system of medicine. But try to remember Dashamula Katutraya Kashayam should not be given directly, and it must be given along with honey and hot water. Ushnodaka and Madhu. So Madhu, Ushnodaka are very, very essential additives for Dashamula Katutraya Kashayam. Then only it is very effective. Otherwise, if you give Dashamula Katutrayam Kashayam alone, it is not going to be much effective in practice. Vyagriyadi Kashayam is also another important area. These are all available in the market. Intake of cool water in abundance at the time of sleep. Protecting head from the cold by covering it with warm and thick cloths. These are all classical references. If you see here, this is reference from the Susruta Uttarasthanam. Navam Pratishayam Apasya. That means except the suddenly developed Pratishaya, that is acute problem. Sarvam Upachare Sarpisha Eva Panai. Gritapana is a very, very essential thing you remember. You take up any long standing Pratishaya conditions, you remember the Gruta. What type of Gruta you need to means, it is always along with the Katu Drava Siddha, Katu Rasa Siddha, Katu Rasa Dravya Siddha, Gruta is the best one. And Svedair, Viriktair, Vamanaisha Yuktai, Kalopapannair, Avapedanaisha. Avapedanasya is also very important. And Vamana Virechana is also very important thing, but very important even by subsequent commentators. Dalhana comments upon that Sarvesham Pratishayanam Vatatmakatvat Sarvesham eva Sarpirpanam. The Grutapana is very important modality, you remember. So wherever we come across the Grutapana is advocated, and which Gruta you need to, so you can think about the Trikatu Siddha Grutas. Shiro Virechana in Pratishaya is another important advocation. It is effective in Pratishaya, Kafajeshu, Vikareshu, Gandha, Ajnane, Pinasa, Ardhava Bedaka. These are the areas where Shiro Virechana is done. And if you see the Apachamanasya Hi Pachanardham, if it is in Apakvavastha of the penis Pratishaya, then you need to go for Pachanardham Svedo is done. Svedam Sthaniya Sveda is done. Hito Amlair Ahimamcha. Amlarasa Pradana Hitakara Aharas are given. Ahimancha Bhojam means that is hot served food is very essential in Pratishaya patients. Nishevya Manam Payasa Ardra Kamva. So along with the ginger, milk is given. Sampachayedeshu Ichuvikara Yogai. Ichuvikara means Guda, Gudadi. Vikaras are very essential in the management of Pratishaya. So this is a study conducted, published in Journal of Ethnopharmacology in 2005 on Guduchi. Guduchi, because you know all the practitioners used to go for the Amruta, the best choice, because Amruta has the direct effect on Pratishaya, and there was a double-blind placebo-controlled study conducted on T. cardifolia extract on allergic rhinitis. They consider that the herb has well tolerated, well accepted by the individual. It has reported to relieve the sneezing, nasal discharge, nasal obstruction, nasal pruritus in patients with allergic rhinitis. So another best choice after the Ichuvikara, Sarpi and Avapeda Nasya, the best one is Amruta. You just remember the Amruta. Amruta is a very important drug for the Pratishaya. And another important, while describing Susruta Uttarasthanam, Nivata Seyyasana Chestanani, that is some advices are also given. lying, sitting and work areas must be free from air, direct air. That is very important, so that particulate matter can be minimized. Even modern system also advise the same. That is the reason why in the Western countries they close the doors of the cars and they travel. And murdno grushnam cha tadaiva vasa. Heavy and hot cloth wrap overhead. This is also advised. Tishnam vireka sirasa sadhuma. Pungent arraigns. Very important. It is a desensitization therapy. If you sum up, rutsham yavannam. Rutsha ahara is advised in Pratishaya. Vijayacha Sevya, Haritaki is another important drug after the Amruta. You remember, whenever you come across the conditions of either Pratishaya, Kasa and Tamkashwasa, you should not forget the Haritaki. Haritaki can be given in any form, either in the form of Churna or in the form of Avalehas, in the form of Chitrak Haritaki, Agastha Haritaki. So this must be the very part of your prescription.